Welcome to Try Not to Overthink It, where we explore the intricate landscape of mental health, well-being, and everyday life. I'm RJ.
And I'm Khalil.
Join us as we dive into insightful conversations, expert perspectives, and personal stories that shed light on the various dimensions of mental wellness. Whether you're seeking guidance, inspiration, or a deeper understanding of the human mind, this podcast is your safe space to engage, learn, and navigate the journey to a happier, healthier self. So today we are going to be discussing the benefits of men participating in therapy. For a lot of us, and this for me as a therapist, I've worked both inpatient and outpatient. Men do not participate in therapy as much as they should. This has been something that I have noticed in my time of being a therapist, a clinician, both inpatient and outpatient, both in the voluntary as well as the involuntary setting. I have noticed that for a lot of us, as men, we view discussing our feelings, discussing our struggles, discussing the demons that we're battling or the things that are attempting to overcome us. We view those things as an admission of weakness or an admission of vulnerability. And I think that it's important that for us as men, that Khalil and I unpack this subject today. So what are your thoughts on this, Khalil?
Yeah, so, I've obviously had this discussion with many men from Caucasian to African American to Asian. I've actually had this conversation with, and we know there's a lot of statistics on that depending on your culture. Speaking with the Asian American man, this is something that's not at all accepted in his culture. It's not talked about. Mental health is something where, they let certain authorities deal with it, right? Now, with African American and Caucasian men, what I found is that the fear of appearing weak is probably the greatest obstacle, but also during the times of any said depression or grief or anguish, right? They're used to talking it out with other men, but only to a certain point, right?
Yeah.
They're not going to get the right perspective on certain things. And it's cultural, right? So even when I talk to some of the African American males, most of the time when they're starting to discuss like a loss, like, hey, man, my brother died, right? And when they're starting to discuss something like that, often the people in the moment will give them the support they need. So I don't want people to think that African Americans don't get support. They get the support in the moment, right? At the funeral, at the repast, at the wake. Then after that, we're actually told that, hey, we've already went through our stages of grief in that like 2 or 3 day span, and we should be at the acceptance stage. And I have to go in there and undo that for people, right? Because we're kind of told at a young age, hey, you're a man, you don't cry, you don't show your feelings, you don't open up like that, right? That's just what we do. And that's not just cultural. That goes on a wide spectrum when you talk to men from different cultures, right? We're all kind of told that. So I think me and RJ, we talked about this before. Even if you look at the toys that men play with, right? They're tough. Nobody expects them to at any time be vulnerable, right? So when I'm talking to these people, it's almost as if their families believe, this is a belief system now, and it's hard to threaten a belief system, that after that person dies, you're supposed to be depressed for a while, and then all of a sudden you have acceptance. And we're going to get into that because we know with the stages of grief, all right, you don't get to acceptance until the last stage, right?
Yeah.
So how can anybody all of a sudden jump from, having this unexpected death or timely or something that happened at an untimely moment, right? To all of a sudden, I'm accepting that this person who I spent a lot of time with is gone. Yeah. That doesn't happen in real life. This isn't, it's not a movie.
Yeah.
People grieve for long periods of time.
Yeah. I think that for a lot of us, not understanding how therapy can help you is also a barrier it's also a barrier and a reason why people don't necessarily always seek it. Because when you don't understand how something can help you, like it's no different than taking a medication. Like where I had to explain to somebody how a vaccine works. The vaccine isn't a cure.
Right.
What the vaccine does is it alerts your body that, hey, something's in it that's not supposed to be in here. Your body will then recognize this is not supposed to be in here. Your body will then go into overdrive to fight off whatever that thing is. Your body then creates antibodies and the defense against what is not supposed to be in here. And so, domino effect, when your body does experience whatever it was exposed to through the vaccine, guess what? Your body kicks it. Your body's able to beat it down because guess what? I done been here before. I've already experienced it.
Next time
but
it
most
comes
people, most people, when they don't understand how a vaccine works, they're just against getting the vaccine. All they know is what they know, which is in some cases nothing. Right. So when you look at the benefits of therapy, my main thing is the improvement of your overall mental health. It helps you alleviate symptoms of mental health issues such as depression, anxiety, and stress. And regular sessions, keyword here, regular sessions. And what I mean by regular sessions can mean different things for different people. Some people, it's every week. Some people, it's every day. Some people, it's a couple times a week. Some people, it's once a month. Regular sessions, as long as you are consistently staying on schedule for whatever is regular for you, is important. But regular sessions help you develop coping strategies to deal with life's challenges, as well as it allows you to enhance your overall mental well-being. I cannot state that enough, that for a lot of us, we think that it's okay to just ride the wave, where I ride it up and then I survive it bottoming out. Then I ride it back up and then I just up and down, up and down, up and down. And that in and of itself is a recipe for chaos and calamity.
Right.
Because again, life is not meant for us as human beings because we're at the top of the food pyramid. When you look at the grand scheme of things, there are not many animals, not many things that view us as prey.
Exactly.
Most things will recognize that's a human over there. Let me go the opposite way. Even things like lions, tigers, and bears, they'll recognize that as a human. Let me go the opposite way. Life is not meant for, not all the time, but in most instances, if it's not protecting, it's not injured, it's not protecting a child, it's not protecting children or young, it'll go the opposite way of a human being. Life is not meant for us to be struggling and surviving.
Right.
So when you have the opportunity to participate in something that potentially can alter your life for the better, hey, why not take a chance? Why not give it a chance? And that's something that I impress upon clients all the time. Another thing for therapy is it helps you develop emotional awareness and being able to express your emotions.
Yes.
As a man, you get the opportunity, as a man, that is participating in therapy, you get the opportunity to explore and understand your emotions better.
Right.
It leads to healthier, emotional expressions. You get to understand why you feel the way that you feel. You get to understand how the way that you express how you feel impacts those around you. It also kind of helps break down societal barriers that often discourage you from showing vulnerability.
Right.
Because as you start to unpack and process your thoughts, your feelings, your emotions, instead of allowing them to control you, you are processing them. You start to recognize that it doesn't make you weaker to cry. It doesn't make you weaker to show vulnerability and be able to say, hey, I ain't got this all by myself. I don't have all the answers all the time.
People can't process anything if you can't name what you're going through. I'm glad that you just said that, right? How am I going to process if I can't name the emotion? I can't name the feeling. How am I going to get my cognitive, rational mind working, my frontal lobe working, if I don't know what I'm feeling?
Absolutely.
You talk to people and they're like, well, I think I was pretty depressed for the last couple of months. Well, tell me how. Tell me how so. Well, this happened and this happened. And I was like, hey, did you tell anybody? Well, I didn't really know what to tell the people. If you can't name it, how are you going to process what just happened to you? It's impossible.
Absolutely. You're right. I mean, not even just that, but it impacts how you interact with other people. It impacts the relationships you have with other people.
Right.
Because the thing about it, though, is like what people have to understand is nobody wants to be around someone who is emotionally volatile.
Right.
Nobody wants to be around someone who is an emotional vampire. You know, no one wants to be around someone who cannot regulate their own emotions, where you're relying on somebody external to manage and to regulate your emotions. That becomes draining on the people around you. It does. It becomes draining on the people around you because, again, we all have our own emotions. We're all dealing with our own things. And then each one of us having our own battles, our own struggles, our own demons that we're fighting. I can't now take upon you take yours onto myself and help you, just regulate your mood and your feelings all the time.
Right.
And so for a lot of us, that kind of goes back to, what I was saying of it improves your relationships. You develop better communication skills. You learn how to talk to people better, how to engage with people better, which and how to interact with people better, which ultimately leads to more meaningful and fulfilled relationships with your partners, your family,
Children.
your friends, your children, the people you work with. Because you can definitely tell, like for me as a therapist, I can definitely tell when the people that I work with or that are employed by me are going through something, because I can tell. It starts to affect their performance, the way they engage with other people, how they do their job when they do their job. Do they show up on time? Are they disheveled when they come to work?
Right.
Like, it starts to affect your overall performance. And so anyone that is halfway paying attention notices the subtle changes, the subtle shifts in your behavior. And so that is where, again, by being able to, partake in therapy, you start to improve your relationships. It also promotes empathy and understanding of other people. For a lot of us, when we're not in touch with our own feelings, how can I relate to somebody else?
Exactly.
How can I understand someone else? How can I put myself in their shoes? Like when we listen to, both Khalil and I, for those of you who are listening to the podcast instead of watching it, both Khalil and I are African American. So in the last, 10 plus years, you've seen, people be more aware of violence directed towards African Americans, regardless if that's, police violence or civilian violence, but violence directed towards African Americans. People are more aware of it. The reason people, are starting to become more aware of it is people are starting to empathize and being able to put themselves in our shoes and say, hey, that could be my son. That could be my father. That could be my brother. That could be my sister. That could be my aunt. So because people are in touch with their humanity, their feelings, their emotions, they are able to put themselves in our shoes and be able to relate to the struggles and the plights that we have to deal with. And that is what one of the things that you can, as a man, learn in therapy, is how to empathize and how to connect with other people so that you can better engage with them and better understand them when they're talking to you or when you're engaging with them.
Right. And obviously, right, we want everybody to have healthy communication with their spouse, with their children. We want people to be able to understand certain dynamics that are unhealthy in your family, right? Therapy helps you do that complete self-assessment, and it promotes self-awareness, right? It promotes the level of emotional intelligence RJ said he had with his employees, right? When I'm operating in a space, right, where I acknowledge my emotions and feelings, it's easier for me to see when other people are emotionally disturbed, right? I can operate in that space. A lot of people will tell you things and you already knew what was going on, right? Like you said, you'll see people come in disheveled. You'll see people come in and they can't really focus on one topic. They're bounced from this thing to the next, and they're usually pretty consistent, right? We can pick up on certain nuances that most people wouldn't be able to. One of the things is the self-assessment and self-awareness right? That's a process in itself. People don't want to look at themselves holistically, right? They just want to point to one particular problem. It's like going to the doctor, be like, man, my toe hurt. That's all I know, right? It's my toe hurts, right? And you completely ignore your knee, your back, and neck, right? It's just one thing I'm focused on. Well, a self-assessment, you get to look at all these different interacting parts, right? Because, hey, I'm gonna tell you, if your foot hurts, usually that means you can't walk properly. So in order for you to walk, you've been overcompensating and using the opposite foot and knee and leg and hip and thigh to walk, right? So eventually that other side of your leg is going to start to hurt, right? So that's what people don't understand. Holistically, I have to start to look at myself in order for me to change. I need to start seeing it might be not just how I interact with my family, how I interact with my coworkers, how it might be how emotionally volatile I am. All right. There's a lot of people who probably have already told me, hey, man, I hate seeing you get angry. Or man, you're constantly in a negative mood. Or maybe you don't have too many friends because people stay away from you because they're used to you consistently being emotionally volatile, right? We need to look at some of these areas where these defects and flaws are, and people don't want to do. All right, that's why people don't really like therapy, is because of the self-assessment aspect. What's going on with me? What are some of the things that I'm lacking? All right, am I insecure? Do I suffer with issues with jealousy? Right? When I'm working with the therapist, these things are going to come up, and the therapist is going to help point that out. Once that therapist points that out, right? Usually you're going to get some form of resistance because people will be like, oh, well, I don't always do that. Well, you've told me the last few times you and your wife have had this conversation, or you and your child had this interaction. It seems like both of you get defensive, or it seems like, you get jealous when that person's with that person. The therapist is going to be able to see it because they're non-objective and non-judgmental, and they're on the outside looking in. It's a lot easier for them to see. And when you see that dynamic and it starts to work, because I have a therapist. When I go in there and I get to speak with the therapist, it's like, okay, how did I miss this? Right? The light bulb moment comes on. And that's why people are so afraid, is because, like, well, you're telling me you don't want to know yourself. You don't want to know yourself better. You're resistant because when you go in there, you're going to have to look at some things that you probably haven't looked at in a long time.
Well, I don't even think it's just that. I think that for some people, the denial of, and I have this conversation with people all the time, about insight.
Mm-hmm.
For those who don't work in the medical field, insight is the understanding that you have a problem.
Right.
That something, like in psychiatric services, we talk about a client having insight, a client recognizing that they have a mental illness, that they need treatment, they need services. Without these services, without this treatment, they will repeat and become unwell, and then it's just an ongoing cycle of hospitalization, involuntary commitments, jail, something of that nature. The insanity, doing the same thing over and over again, expecting different outcome. So for most of us, and I've seen this happen, where people will dip, dodge, avoid, duck therapy because I have to acknowledge that there are things that I'm lacking in. Mm-hmm. There are things that I'm doing incorrectly. There are things that I am wholeheartedly wrong in. And like Khalil alluded to, you at that point will then have to change your worldview. And most people are not ready to face the cognitive dissonance that comes along with sitting in therapy. Because I have to now question my whole worldview.
Right.
That, like, if say you have been a habitual cheater, and that's all you've ever been doing, is you can never have a healthy relationship because you're just always cheating all the time. Yeah. And then when you have to sit down and unpack why you was cheating all the time, I'm always cheating all the time because I saw my daddy cheat all the time. Yeah. But then how well did that work out for your daddy? No, it didn't work out.
Right. A lot of resentment going on, right?
Yeah, there's things that people then have to unpack, but not even just unpack, but they have to face.
Right.
You can lie to everyone else, but you can't lie to yourself. And I tell people this all the time. Like when you fully partake in therapy as you are supposed to, it's like sitting in front of somebody naked. The reason I say that it's like sitting in front of somebody naked is when you're naked, there's not many places for you to hide things at that point.
Yeah.
There's not many places for you to hide things. There's not much you can hide because nothing's left open up to the imagination because you're butt naked.
Right.
So, when you look at that and you are sitting in therapy and you are sitting down with your therapist and you are being unabashedly honest, respectfully honest.
Yeah. Vulnerable.
Vulnerable. You are essentially sitting in front of this person naked and you are putting everything out there because you cannot fix things that you don't address.
Right.
You can't heal from things that you don't address. Like you see this in today's society a lot where people talk about wanting, and this is a shameless plug, just shameless plug for our episode about being a high value man. You hear women talk about wanting a high value man, seeking a high value man. You have men talking about being a high value man. But then people keep finding themselves in maladaptive, destructive, or toxic relationships.
Right.
The reason that both men and women find themselves in destructive, maladaptive, unfruitful relationships stems from the fact that there have been things that you have experienced in your life, good, bad, or indifferent.
Mm-hmm.
Typically, the bad things that you experienced that you did not heal from. And you not being healed, you not having processed those thoughts,
right.
You not having processed those feelings, those emotions that are associated with whatever happened, makes you jaded.
Yes.
It's kind of like being a broken piece of glass. If you've ever seen a glass, just a regular wine glass, you can touch it, you can rub it, you won't cut yourself. The moment that you tap it and it chips, it's now sharp. It'll cut you straight to the bone.
Cut you to the bone.
So now, like Khalil said, it's dangerous. So now we're moving through different phases, different seasons, different parts of our lives. And because we have not healed, because we have not processed, because we have not overcome the negative feelings, the negative thoughts, the negative emotions associated with whatever it was that we survived. Because when you've lived long enough, you've survived something. I don't care what anybody tells you. You survived something. If
there's some resilience, right? If you
because not all scars are visible to the naked eye. Mm-hmm. Some scars are internal, and so those internal scars are what therapy is for.
Right.
To be able to heal and get some closure on those internal wounds that are being left untreated. If you were to leave a cut untreated, there's a real possibility it could fester and it could get an infection.
Right.
So the same way you wouldn't leave a major gunshot wound untreated and unbandaged, unclosed, why leave emotional trauma, mm-hmm. Mental trauma, right. Unbandaged, untreated, unclosed? That just says that's the part where for a lot of people, the having to face that I'm not always the victim all the time, because you'll have some people where they'll sit and it's everyone else's fault.
Yeah, the blame game.
Is everyone else's fault. It's never they never play a part in anything. But when you're sitting in therapy, you got to sit with a therapist who is being non-judgmental and they're being unbiased, they're being impartial.
Right.
Any therapist worth your money is going to point certain cognitive dissonances out to you.
Right.
They're going to point certain things that do not jive, that don't line up, out to you.
Well, look, I had a similar situation, right? I have a client, he's going through something with his ex-wife, and we kind of talked about this. It's like, if this is somebody's behavior, if they're always going to be like that, well, then I have to expect that that's probably not going to change, right? So the only thing I can change is me, right? I can't keep playing the victim. Well, they're always doing this, or well, if that's what they do, then obviously I should already be prepared. So why am I allowing them to take anything from me at this point, right? That's what I'm trying to get him to, is that, hey, I'm not a victim in this. I understand what's going on. And you know what? I have to draw a certain boundary and I have to draw a certain line.
Absolutely.
And boundaries, Unique talked about it in one of the last episodes we did. Boundaries in everything. It's in everything
Absolutely.
therapeutic, right? You might realize you don't have any. I have people who it almost hurts them to say no, right?
Mhm.
That's a boundary issue. You're people pleasing at this point, and it might not be as extreme as when we hear what people pleasing really is by definition, but there's some level of validation that you're always looking for. So if you say no, boom, I feel invalidated right there. That person's not going to like me anymore because I said no, or that person's going to be upset at me because I said no. Well, there's some trauma there. It's okay to say no. It's okay, especially if it's for your mental health, right? When you meet someone who doesn't even understand how they got to that point where they have a difficulty saying no, that means there's something that needs to be unwrapped there. There's something that needs to be looked at. In a lot of men, they think, well, it's weak going to therapy. No, it's weak when you don't know yourself. Because the man who has mastery over his emotions, all right, that's a dangerous man.
Absolutely.
You know, we hear about it in the 48 laws of power. If you don't have mastery over your emotions, you can't do anything.
There's nothing you are going to be able to master if you can't master yourself. You're not going to be able to master anything else around you.
Yes, very difficult topic to have with men. And when I do tell them that, you know, it's kind of like people take offense to it. But you don't know yourself. You don't know yourself. You don't know what you're feeling, right? And the only thing that people see is anger, right?
Mhm.
Or they see the resentment, right? Say, oh man, yeah, he's just a nasty individual. Oh, I don't. No, you don't know what's going on with that man. We haven't
Well,
broke it down. We haven't allowed him to process what's going on.
Well, I mean, what you're speaking to is personal growth and self-awareness. I mean,
Right.
when you engage in therapy, it fosters self-discovery and personal growth, which enables you to understand your values, things like your goals, as well as your own behaviors on a much deeper level. You know, it's one of those things where for us, like, you know, I have to point this out to some clients sometimes. You know, when you are actively, you know, and when I say actively, I mean you are all in on the therapy. It supports the development of a stronger self and improved self-esteem. I mean, you start to unlock new levels of yourself, new facets of yourself. It's like you rediscover yourself,
Right.
because you start to see that, you know, there are certain things that I was doing incorrectly because this, and this over here.
Right.
You know, so I was not, you know, I was not managing, you know, my anger. You know, I was not managing, you know, my children appropriately. I was not loving on them like I should have. I wasn't the best husband that I could have been, because I didn't know who I was.
Mm-hmm.
You know, and that's where, you know, like I said, it's a very good feeling when you see people kind of have that realization,
Right.
of, you know, there were certain things I was in my own way. I was blocking my own blessings.
Right.
I was closing the door in my own face. I was tripping myself up because these things that I was doing or saying or believing or thinking were impeding upon me being the best version of myself. And essentially, like I said, that's one of the things that therapy does, is it does help you with that. It helps you with, you know, just personal growth and self-awareness.
Yeah.
It also helps you with managing your stress.
Well,
you know, when you're go ahead.
Yeah, well, I was going to say, you're kind of alluding to, when you talk about that personal growth and development, is the ability to be free of these burdens, especially things that happened in the past, right? To be happy, joyous, and free, right? I'm stealing that from from Narcotics Anonymous, right? Be happy, joyous, and free, right? Because there's these heavy burdens that, with guilt, with shame, with depression, with anxiety, there's heavy burdens that follow people when you have not processed what you've been through. And you'll notice that with people. It's like they're not free. You know, spiritually, they're not free. They're trapped in this bondage. And that's what therapy will help people release out of that bondage, man. I've seen it with people, and I'm like, man, that's what we want. You shouldn't be carrying around all this baggage. Sorry to interrupt that.
I mean, But that brings up another point, though. The reduction of negative coping mechanisms. We all have them. Therapists or not, we all have things that we do that we use to cope with stress, that we use to address problems or issues. When some people eat, some people will smoke a cigarette, some people will drink, some people will work out a lot or dive into a new hobby or a new relationship. We all have negative coping mechanisms that we use to address certain things that are going on in our life. When you are in therapy, you are learning healthier ways to cope with your problems.
Right.
Reducing the reliance on the negative behaviors, such as I said, substance abuse, being aggressive, isolating yourself from other people, cutting folks off, because it promotes positive behavioral changes and a healthier lifestyle choices. I think that for a lot of us, by being able to understand that the things that we were doing are incorrect, and then also the things that we do to address the things that we were doing were incorrect. You're never getting a chance to avoid being in a chaotic situation, because the things we were doing were wrong.
Right.
And then the things that we were doing to address the things that we were doing were wrong. So you're never free. You're never unburdened of the just the cycle of negativity and maladaptive behaviors. And so for, when you're sitting in therapy, you get to unpack that. Like, I remember, I never forget this. And this client, to this day, when I see her, reminds me of this. Years ago, when I was working at an inpatient behavioral health unit, this is when I was first getting my license. I was doing my hours. She, we're doing a group. And so I explained to her that coming to the hospital all the time, every time you are facing a problem, is not going to make your problem go away.
Does not.
We are not turtles, or tortoises, where if you've ever seen a turtle or a tortoise, you take a stick and you poke at it, it goes inside the shell.
Right.
It knows, as long as I sit in here, I'm safe. You can't get me. Eventually, you'll give up in trying to get in, and you'll go away. That's not how problems work in real life, where I'm going to go to the psych hospital or the inpatient psychiatric facility, hang out for a couple of weeks, not address the problems that chased you in here.
Right.
Because when you leave, you're going right back. Those problems out there waiting, they're circling like a shark. They're waiting on you to come out. So if you're not addressing the things that have you misusing substances, if you're not addressing the things that are causing you to be non-compliant with your medications and miss your therapy appointments and miss your medical appointments, those things are still going to be there when you get out. So you got to address those things so that we can stop seeing each other in this setting. And so to this day, this young lady, and this was like 5 years ago, to this day, 6 years ago, to this day, when I see her, I'm not being a turtle. I haven't been hospitalized this long.
Wow.
Because at the end of the day, she recognized that I was using maladaptive coping mechanisms to deal with maladaptive behaviors that I had outside in the regular world. So my maladaptive coping mechanism was going to the hospital. The hospital was a Band-Aid on a gunshot wound.
Right.
It just stemmed the flow of blood. It doesn't address the fact that, hey, you got a bullet lodged in you. Your body recognizes it's not supposed to be in here, so it's going to keep on bleeding until it gets the bullet out. Until you address the fact that you've been shot,
right,
you're going to keep bleeding, regardless of the Band-Aid that you put on it.
Right.
So when we addressed the gunshot wound, guess what? We were able to stop the bleeding. No more hospitalizations, no involuntary commitments. So when you are in the therapy sessions, and you are partaking of the therapy, you learn how to address the quote unquote gunshot wound so that you don't slowly bleed to death. Well, because even if you put a Band-Aid on it, you're still slowly bleeding.
Well, what you're just talking about is people on how they address crises, right? If I'm in a crisis, I know for a fact that obviously I've allowed something to manifest for a very long time. Now it's out of control, right? And when I'm talking about an emotional state of crises, right? Where I'm going through something and it keeps building up and it keeps building up, and then boom, all of a sudden I'm mentally unwell. I have a friend who does this pretty often. And it's a little scary because I can't allow myself to get so down, so depressed that I need hospitalization. I need to do some intervention. I need to be speaking to my therapist. I need to be out there talking to people who are healthy, who want to help me do some healthy coping skills, who want to encourage me and motivate me to do something healthy for myself. I need to be taking all the precautions so I don't ever get back to crisis. All right. Because
Mm-hmm.
the person I'm speaking of has done this a few times in their life. And I'm like, we got to do the intervention now before it builds up
Mm-hmm.
that emotional barometer, right? Before I get to the
Yep.
point where it's necessary, where my top's going to explode and I start acting out and the behaviors change and I have to go to the hospital so they can give me a sedative, right? There's no need for that. Myself and RJ, we've been in a situation where we work inpatient psych and we've seen people do that, right? Like you said, you're just going to the hospital to put a Band-Aid on it. There's got to be an intervention you do before we even get to that point where we're in a crisis, right?
Mm-hmm.
You can't walk around, all right, with a Band-Aid on a bullet wound because then you're gonna be
Mm-mm.
leaking on everybody else's carpet, right? And I'm gonna notice
Yep.
something with you when you're around me. What's going on? You're angry, you're irritable, you're this, you're that. People aren't gonna want to be around you. You're
Mm-hmm.
not addressing the real problem. I've been shot. We got to address that problem, right? So I think a lot of people are confused by the time you get to the hospital. Now they want to commit you, right?
Mm-hmm.
Because I don't deal with no therapist. I don't want to go see no therapist. Well, look, the longer you kept pushing that back and pushing away from that thought that somebody else could help you, all right, or you know how people say, well, I don't want to go visit a shrink. A psychotherapist is not a shrink. All right. That's not what they do. They're not trying to do something to your brain. Cognitive behavioral therapy wants to change how you think. Yes, that's your thought process is in your brain. But in turn, we want to change your behaviors. And so if people really thought about that term where the shrink came from and stuff like that, and how that really doesn't fit into what we're doing here today, we want you all to understand that it's okay to be vulnerable. It's okay to be exposed. RJ mentioned the literary allegory earlier of basically the Bible, right? Adam and Eve, when they finally had that foundational recognition of all the things that go on in the world, right? It's like all of a sudden they open Pandora's box, right? And the reason why I say literary allegory is because this is a story that's meant to tell something else, right? They start to explore things and they notice that they're naked.
Mm-hmm.
When they were with God and when they were one
Mm-hmm.
with God and they had that self-awareness of the spirit, they didn't feel like that. But when they started to understand the self-awareness of what we do in the world, and they started having all that stress from the world and all the ills that come from the society, right? And they start looking at themselves in a worldly view, they were like, oh my God, we're naked. I got to put some fig leaves over me, right? And then God
Mm-hmm.
says to them, who told you you were naked, right? Right? Who told you that, right? Well, because they had that knowledge, right? And once they got that knowledge, all of a sudden I'm vulnerable,
Yep.
right? But they weren't like that when they were having that spiritual knowledge. And I think people miss the point of therapy. A lot of times it is to get you to look at things on a higher level because
Mm-hmm.
all we're seeing is this base level of vulnerability. Man, if you start getting to a higher level, you really start seeing yourself differently. You get the full view, the holistic view of yourself. And then you'll realize that you weren't missing anything. You weren't lacking anything. It's just in here we perceive we were. And that's what the therapist encourages us to do, is to help change our thinking. Nobody's shrinking anything. We're expanding.
You're absolutely right. I mean, like what you were alluding to was, breaking the stigmas. Like for a lot of things, especially in today's society, for a lot of things that put men in a vulnerable state or a space to where they could be perceived as weak.
Right.
People tend to shun it. People tend to be averse to it. People tend to dip, dodge, roll, get out of the way, duck, because of the negative connotation associated with it.
Yeah.
A man participating in therapy, it helps to dismantle the stigmas and, just centered around men's mental health. And it causes you to start to take a deeper look at yourself.
Yeah.
It makes you more aware of who you are, who you could be, what you should have been, what you could have been. Like, it makes you have those conversations with yourself. And it allows you to be able to, like you were alluding to earlier, self-assess. Mm-hmm. It allows you to be able to self-assess. But one of the more important things that it does in regards to things is the fact is it sets a positive example for other people.
Yeah.
Promoting a culture where seeking help is normalized, it's encouraged, and it's championed.
Yeah.
For a lot of us, like Khalil and I, another shameless plug, Khalil and I, in the episode where we talked about being a high value man, you are more likely to do things that you see, mm-hmm. that you see work out, that you see be successful for other people. So when you see therapy be successful for other people, when you see someone gain, grow, flourish, be the best version of themselves through therapy as a male, guess what? You're more likely to partake in therapy yourself.
Right.
And that's where for me as a therapist, I thought it was important for Khalil and I to have this conversation because, again, as men who work as therapists, because when you look across the healthcare field, we are the minority.
Right.
We are the minority. Like when at the company that I work at, most of the therapists are female.
Oh, most of them.
I mean, there are male therapists that work there, but most of the therapists are female. Good 90% of them are female. Now, there are some males here and there splashed around, but typically in healthcare, it is a female-driven, workforce because it is a helping profession. And the thing about it, though, is like I said before, as a therapist, I would not be doing my due diligence as both a therapist and as a man to not espouse how we can grow and be better men, be, mind the pun, being a high value man by being complete.
Yes, whole. Yes.
Being whole. Khalil alluded to this earlier. Holistic. Being complete. You can't be complete when you're not in touch with yourself.
Right.
You can't be complete when you're not healed. You can't be complete when you're emotionally unavailable, when you're emotionally unregulated, when you don't know how to engage with other people. You can't engage with other people effectively, because again, you can, but effectively where people are able to receive it and willing to receive it. When you're not complete when you can't connect and resonate with other people.
Right.
Like these things start to, by not having control over yourself, as Khalil alluded to earlier, as one of the 48 rules of power, by not having control over yourself, how can you master things around yourself? You can't effectively lead somebody when you're not in control over yourself. And so when, another shameless plug for one of the episodes, submission in relationships. How can, and I always go back to this as a man, as a high value man, as a leader in my community, I cannot expect somebody to follow me when I don't give them something worthy. Key word here, worthy of following.
Yes.
I've got to be the change I want to see in other people. So in order to be the best version of myself, because, we all take losses.
Right.
We all take losses. If you live long enough, you can take a loss.
Yeah.
You're going to take more than just a loss. You're going to take a lot of losses. But with the therapy, guess what you do? You learn how to turn those losses into lessons.
Yeah.
So by turning those losses into lessons, they don't keep being losses. Mm-hmm. You either win or you learn. That's how I live. Yeah. I got that from the show Vikings that was on the History Channel.
Yeah.
The main character was like, either I win or I learn. And I'll be damned, he did not lose a whole lot.
Right.
If he lost, it was only temporary because he came back smarter, better, and more equipped the next time.
Well,
but that's
what we want for men, right? In this
Mhm.
situation, we want you all to grow from this, learn from this, and in turn, the next time you're faced, because life is going to happen. Life is never stopping. It's constantly in motion, right? There's always something going on. The next time something happens, you're prepared. You know what to do.
Mhm.
You have the skills.
Yeah.
You're learning. And if you're going once a month, that's excellent. You're keeping your skills up. You're learning how to communicate. You're learning how to be open. I have guys that I see, they'll email me and say, hey, this is what I've been looking at. This is what I've been learning. This is what I've been doing. I only see them once a month now. All right. They're showing me stuff that they're learning, right? The growth. That means that you're going to be able to apply this the next time something happens. And there's always the next time. Life doesn't just sit still. It's constantly moving. The earth is constantly moving. Things are constantly in motion. God is constantly moving, right? God is constantly working, right? Psalm 121, right? God never sleeps, never slumbers, right? And I'm
Mhm.
saying that to my believers because a lot of times I'm with people who say they believe, but if you have this faith, then you know something is always going on. There's always going to be
Yep.
something that happens. You can't say, "Oh, I'm healthy, I'm cured." There's always something going to be happening. So we have to prepare ourselves. That's why it's good to keep seeing a therapist, keep working with a mental health provider, keep taking your medication. With me, I want to see consistency. If you keep doing something, then you're not going to fall off all of a sudden.
Well, 21 days of doing the same thing makes it a
Makes it a
habit.
habit. Yeah.
And, doing something enough makes it a lifestyle.
Yeah.
And so when being the best version of yourself, and this is the thing, and this goes back to the episode that we talked about dysfunctional behavior. In that episode, we talked about Risa Tisa and the
Yeah.
whole calamity thing that happened with her and her relationship.
hmm hmm
So, I said this in that episode. She was so busy focused on being chosen, she didn't choose herself.
Yeah.
So, by choosing to partake in therapy, that is one of the most selfless things that you can do for yourself.
Right.
Because at the end of the day, you were choosing to allow yourself to heal. You were choosing to allow yourself to grow. You were choosing to allow yourself to not stay weighted in the past. You were choosing to allow yourself to be the best version of yourself. You were choosing to allow yourself to grow, to flourish, to be a better man, a better father, a better pillar of your community, a better leader. You're choosing yourself at that
Right.
point. And by choosing yourself, you will see things start to turn around. It doesn't matter how bad things are. When you start to choose yourself and you start to invest in yourself, you start to pour into yourself. There are certain doors that will open for you that were closed to you before. There are certain opportunities that you thought that had passed you by or that you never would have gotten that will come your way because you are in a different vantage point to where you were able to see things that you weren't able to see before because now you are no longer standing in your own way. And it's just one of those things that for me as a therapist, I cannot espouse the value of what therapy does, not only just for men, but for everybody.
Forever.
Men, women, and children.
Yeah.
People of all ages.
Yeah.
Therapy is something that saves lives. I mean, it sounds cliche coming from a therapist. Therapy saves lives, but it's real. That's real talk.
Yeah.
Straight like
Well,
that.
RJ, you mentioned it earlier, right? I think when we talk about, I'm gonna use some therapy here, right? Eric Erickson
Mm-hmm.
says, well, there's 8 stages of development, right? Each stage, the person has to go through some of these natural states and actions that we need to when we're, from adolescent stage to adult stage to, even when we get into, our retirement stage, right? He basically touches on all these different transitions, right?
Mm-hmm.
What he says is, if I don't complete this stage, I'm going to get stuck there. It's so crazy because when you start to look at it, it's funny. Even some of the stages, I didn't have a healthy marriage. I got divorced, or I had children. The situations happened, or I had children out of wedlock. You get stuck in certain stages. And he's saying, you can't move forward until you address some of these things, which is, what we push in therapy. Certain life transitions are heavy. They are going to be like a divorce, losing custody of a child, going through moving to a new town, going through a loss of a job, loss of a spouse. These things, if you don't deal with them, you can't go on to the next stage. And I'm not going to say I believe in this whole, like, I believe it all is truth. But I believe now that I'm at the age I'm at, and I've been through some life, experiences, I couldn't transition until I dealt with some of the emotional problems I was having from my last stage, right? I could not be the type of man that I am now if I hadn't addressed some of these things, and I'm still addressing them. I'm far from perfect, but I wanted to say, for men out there, you can get stuck in your adolescent stage. And I'm gonna leave you on that note. I'm not going to expand on it. So I don't want people to get upset, because I'm a human being.
So
I know I can still throw a tantrum like a 13-year-old.
Absolutely. And I mean, it just becomes one of those things where, like you said, you get frozen at certain stages of your life, certain phases of your life, certain seasons of your life. And when you are, like I said, when you are engaging in therapy, it helps you recognize, like, man, I'm still 13.
Right.
I'm still having a thought process of a 13-year-old when I'm a whole grown man in my big age. Right. So the benefits are endless. It is definitely endless in regards to how therapy can change your life, how therapy can save your life. There's a show with, Miss Ayanna Van Zandt, where, she fixes people's lives.
Literally.
Beloved, beloved, she drags you kicking and screaming into a better version of yourself, because she presents you with how things were going before in comparison to how things can go moving forward. And a lot of times people, when they're presented with both outcomes, people tend to pick I want to go in this direction rather than continue to stay where I'm at. So we're going to end the conversation there. This is Try Not to Overthink It signing out. I'm RJ.
Khalil.
If you like what you heard and like what you saw, we ask that you like, share, subscribe, turn your notifications on. We can be found on YouTube as Try Not to Overthink It. I don't know why you'd prefer to listen to us, but, because we are some good looking people. I'm gorgeous. But if you would prefer to listen to us rather than watch us, we can be found anywhere you can get your audio files. We can be found on Anchor, Apple Podcasts, Google Podcasts, Spotify, Audible. Pretty much anywhere you get your audio files, we can be located. And then also, don't forget to follow us on the Instagram and the TikTok. Both of those will be linked in the description below, because we drop content on those every day.
Man. Like and subscribe.
So please subscribe, like, comment, all of those things. It helps the YouTube algorithm and helps us grow. So this is us signing out, and we will catch you next time. Peace.